Hi, I'm Joe Page, and I just completed a student internship here at the Oregon Medical Association. I'm graduating from Oregon State University with my Master of Public Health in Health Systems and Policy. I chose the OMA for my internship because I wanted to do a project that blends my passions for health law and policy with the advocacy work of the OMA. And so I have aspirations to go to law school after this, and so the OMA had a great opportunity to learn more about the advocacy kind of side of healthcare and really combine that with my interest in law as well. For my project with the OMA, I worked with the medical legal team here and compiled some resources for physicians about medical legal partnerships, working with stakeholders from across the state to learn more about what these partnerships are, how they work, and what can the OMA do to connect physicians with resources to learn more about these partnerships. So MLPs incorporate and embed attorneys as part of the care team to better address social determinants of health. And so I got to work with a lot of really interesting and cool stakeholders from across the state who do a lot of really important work in this area to learn more about how we can support physicians in addressing social determinants of health. I also did some really cool work with employed physician resources. I learned a lot about physician employment agreements, contract law, and put together some resources for physicians to learn more about what it means to be an employed physician. I also helped with some work on the corporate practice of medicine, doing some research about other legislative efforts in other states that are going on to bolster the corporate practice of medicine doctrine and support physicians in that area. Coming to the OMA, I was really surprised to learn about the heavy involvement of the actual members of the OMA. I think I had kind of anticipated that it was a staff of people who work to support physicians and PAs across the state, when in reality there's a lot of really important advocacy work and interest that is done by members. I think we often think about doctors and PAs solely in a clinical kind of context, when in fact these folks are really civically engaged and do a lot of important advocacy work on behalf of themselves, but also on behalf of patients and to protect public health. My favorite thing about working with the OMA was the team. This is a really dedicated group of folks, way fewer than I thought it was going to be also, just given the robust operation that they run here. I was really inspired by their commitment to the work that they do, to helping physicians and PAs navigate the complexities of healthcare in the state of Oregon. And really just, I'm inspired by their dedication to the work and their very positive outlook on everything, all things considered, in the healthcare context that we live in today.